Hi, everyone. My name is Dr. Susan DeLaney. I'm a naturopath in Carborough, North Carolina, and we're going to talk about pyroluria today, which is an interesting metabolic issue that affects people's mental health and as well as other things as well. So, a pyrrole is something that all of us have in our blood because it's a breakdown product of hemoglobin. And so it has four carbons and nitrogen, and it evaporates easily in the air. So it is a parent compound to things like bile pigments, porphyrins, and chlorophyll. So in and of itself, it is not a harmful substance, but what it does when you have a lot of them to your body, it depletes you of nutrients, and that's one of the big problems. So I want to talk a little bit about how this came about. Dr. William Walsh, who wrote this particular book, Nutrient Power, is responsible for really bringing this test into the forefront of mental health and nutrition. And I would recommend that all of you get this book and read it. I don't get a kickback from it, but it is really important biochemistry for you to understand about all of the nutrients that affect our mental health. So Dr. William Walsh, a little quick story, he still is alive, biochemist, PhD. He was at the Argonne Science Lab outside of Chicago. And he, as a volunteer, as a Catholic, he worked in the Chicago prison system long ago. And he would help parents get their children back, young adults back into the home and into society after prison. And so he heard stories from these parents um, who had two amazing children. The parents are normal. He could watch them in his office, very loving, very caring. And this other child in the prison was deviant behavior. And the mother would say to Dr. Walsh, he has been like that since he was born. And Dr. Walsh heard that enough times, so he began to say, something's not right here. And this was in the age or time when medicine said to parents that you're responsible for the reason your child is autistic. You're responsible for their bad behavior. So it was all blamed on parents. And he could tell this was not true. So, being a biochemist, he began to draw blood and do urine testing and hair analysis on a group of prisoners. And he found these discrepancies in their nutrient levels and began to put together um, studies of this behavior and these abnormalities. And he presented this at a conference at one point, and Dr. Carl Pfeiffer heard him speak, which began this collaboration that lasted 12 years between Dr. Carl Pfeiffer and Dr. William Walsh. And together they looked at different patients and their urine and lab work and noticed these differences and then began to treat them to help support that. And Dr. Carl Pfeiffer is actually well known because he focused on schizophrenic patients. And he had a brain and bio center, a lab at Princeton, New Jersey. And so it was about in the 1960s when one of his lab technicians noticed that there was some urine sitting in the refrigerator over the weekend. It changed colors, and they called this the mauve urine. And that was the beginning of looking at what was different about this urine. And they began to notice that it was pyrroles that were in there. And Dr. Carl Pfeiffer then tested these people, had three different biochemical imbalances for people who had schizophrenia, and one of them was pyroluria. So that was the collaboration where this began. So then, so why care about pyrroles? Because you and I have them, but the levels that you and I have them are less than 10. And it's when it gets to be higher than that, what you have is zinc and B6, also magnesium. being pulled out of the urine, out of the body into the urine. And so often then you can test for zinc in the blood and find out the zinc is actually low. And so there's a unique set of symptoms, which we'll go into in just a minute. But these are really critical nutrients for neurotransmitter synthesis, like dopamine, serotonin, GABA. You cannot make GABA without zinc. And so these are the nutrients that are required for making your neurotransmitters, which are happening every day. It's not something that you make and then they get used up and they go away. So there's a constant production of these neurotransmitters. And if you don't have them in your body to make them, then you're not able to have these make your own neurotransmitters. So how would I suspect that you have high pyrroles? And these are the symptoms that mostly the mental and emotional symptoms that you might see in a child, an adult, adolescent at any point. So these are kids who have poor stress control. So they're easily disrupted. They get irritable and have temper tantrums. If you say no, they say yes. If you say yes, they say no. And they're oppositional in much of their behavior. And they can have extreme mood swings, and you don't know what set them off. They can't get the pieces of the Legos to go back in, and then they're just furious, or their shoes don't tie well, or all of these possibilities, things are happening in a kid, or they just get hysterical because they don't want these chicken nuggets. They want the other kind that you should buy. They can also have problems with reading. You may see a difficulty in understanding math or just reading books. And they typically have a history of underachievement as well. So they can have a history of severe depression. And one of the interesting things about them is that they tendency to have to stay up very late. They have little dream recall and severe anxiety, severe inattention. Other little things that you might notice about these people is that they're really sensitive to loud noises and to bright lights. So just by hearing this list, you're going, oh, I can recognize some of these symptoms. And maybe my relatives are in the people that I work with for sure. So some of the other physical symptoms that you might see in some of these people are very dry skin. They have poor wound healing, skin issues, and they're pale. They don't tan very easily. They often have morning nausea, so they do not want to eat breakfast. And those are kids that are even adults who just feel like they cannot have it in the morning. Delayed growth and puberty is something that you see. Not every person is going to have every single one of these symptoms, but one of my young adults who was 13, he was nicknamed Shrimp because I think he weighed about 80 pounds, very small for a 13-year-old, picky eater, wouldn't eat breakfast. And once we treated his pyroluria, he gained 15 pounds in the first year, grew 3 inches. The next year, he gained another 15 pounds, grew 3 inches, which put him on a normal trajectory because his pyroluria caused him to have severe zinc deficiency. And he had the other symptoms of poor memory, not able to read and write well. Basically, he was falling behind as a 13-year-old. Some other things that you might see with pyroluria is the white spots on the fingernails. That's a symptom of low zinc. They have joint pain, stretch marks, also this dark or mauve colored urine. Another unusual symptom is that people often complain of this weird abdominal pain. They call it spleen area pain when pyroluria is high. They also have poor muscle development, fat distribution, and they tend to like spicy and salty foods. So if it's a young woman, she may have abnormal or absent periods as well. Pyroluria is actually a marker for severe oxidative stress. So you can see this in people who are not even having mental emotional problems with chronic illnesses. Sometimes this is elevated as well. So neurotransmitter synthesis, this is why it really matters. We talked about the zinc being really important component of these things, of making dopamine. It supports the synthesis and receptor functioning, and the zinc enhances production of serotonin, and it helps regulate this dopamine to norepinephrine conversion. One other thing I want to say about this is that there's B6 peroxidine and then there's P5P. Those are both B6, but P5P is the active form of B6. And so it's a cofactor in all of the synthesis of these neurotransmitters. That's a really important. And Dr. Walsh and Dr. Pfeiffer found out that some people do not respond well to B6 and they respond better to P5P. And exactly the opposite. Some don't respond well to P5P, but better to B6. So they put together the decision that they were going to give them both. So it varies with how severe your pyroluria is. I typically start at 100 milligrams of B6 and about 50 milligrams of P5P and go higher if the pyroluria is severe, like Dr. Walsh can recommend 400 milligrams of B6. That's the top. Typically, some people cannot tolerate that, so I start low and go high on these people. Okay, so here's a little drawing that talks about what happens with high pyroluria is that you have a higher copper with when your zinc is depleted. And this is what a low zinc does. If you have low zinc, you have lower metallothionein, and then which is important for your detoxification. But if you notice in this drawing that the high copper and ascorbic acid make your dopamine shunt to norepinephrine. So you don't want to have your copper too high in that relationship. And the low zinc helps to promote that because the metallothionein needs zinc to help clear copper. So if you're treating pyrroles, these are the nutrients that you would use. The zinc, and that level often depends on what their blood level of zinc is, but Dr. Waltz starts out at about 75 milligrams of zinc. B6 and P5P, the B6 again start at 100 to 200 depending on the severity of the pyroluria, and P5P at 50 to 60 milligrams. Now, if you're on a desert island, those are really the important nutrients that you need to treat pyroluria. But vitamin C and E and biotin and evening primrose oil also help because of the oxidative stress. So he would recommend vitamin C 1,000 milligrams twice a day, vitamin E 400 I use twice a day, and biotin 1,000 twice a day. Evening primrose oil 1 gram a day. So those are some ranges, but everyone is different depending on the severity of the pyroluria and also their weight. So for a child, we use a metabolic weight factor and use less of them according to that weight factor thing. So the labs that Dr. Walsh uses, he also runs CBC, a complete metabolic panel, vitamin D, TSH, ferritin, and iron. And those are complementary blood labs that you need to do, partly because it's shocking that vitamin D is not checked by MDs, and TSH is also can be overlooked in mental health as well. At least I have seen that. So, but the four tests that are needed for Dr. Walsh are copper, serum copper, ceruloplasmin, plasma zinc, and whole blood histamine, which is a marker for methylation, which we're going to talk about in just a few minutes. So if this pyrrole testing comes back normal, then you might want to consider these as well. Maybe this person has heavy metals and lead, mercury, arsenic can be found or discovered in a hair analysis, along with other things. If it's a child in particular, around age 14 to older, if they've had multiple infections, you want to go, is this child having pandas? And you might want to do a strep antibody test. There are other tests that you can go further with if you're not being successful with the Pyrroles and the DHA labs, those four: copper, ceruloplasmin, zinc, and whole blood histamine. But we won't go into that today. So I'm going to do a little demonstration now. So this is the cryptopyrrole test that you should keep in your office and that you give to your patients to take home and do on their own. And I'm going to go through this because there's a resistance to doing it. And if you show them how to do it, it really makes a difference. And so it comes in this little box. And if you keep them in your office, then they can walk home with it. And so as I open it, there's a requisition that they fill out and all the information, and they put it on their credit card. So then you are out of the business of in your office charging and paying for it. So all that information is on the specimen collection form. And actually, that's not it. It's on this form, the test kit form, it's called. And all of that information is required. So, but this information form, the specimen collection, I and everyone else I know who's done it has to read the instructions 3 times. So that's why it's helpful for you to know really well how to do it and to show it to them. So here's the styrofoam box that you get, and you open it up, and it comes with 2 little ice packs and 2 different tubes. Here's the large one. I mean, the bottom has a little powder, which you'll shake, and the small one. Okay. And then conveniently a little cup for them to put their urine in. So I always recommend that they fill out the names on these tubes before they put it in the freezer, because it doesn't stick so well when the tubes are frozen. So what they do is they pee the second morning urine. So I recommend that they do this on the weekend. So they get up and just pee the first time, because that bladder urine is left in the bladder all overnight, and you don't want to collect that. So it's the second one. And then they just collect it and put it in this little cup. And then take that in a darkish place and do it immediately, because this is really sensitive to light. If you remember, pour it in to this little container. Of course, this is nice because it squishes. And the little one, there's a line on there. You just fill it up to that line. Second one, there's also a line, but it has that powder in it. And this one you shake up until it's dissolved. Now, then you just take these 2 things and put them in the freezer and let them stand up. And depending on the freezer, it can be ready in about 4 hours. So by midday, they check it again. And then what you're going to do is take that box and put the ice pack in the bottom and put these little tubes, which are frozen, side by side. And I make sure I make a dent for them. That one's not holding. A little dent. I tell them putting them to bed, just like so. Okay. And they put that in the freezer and let that freeze for about 6 hours or so. And maybe before they go to bed that night, they remember, or hopefully, to put this one, the ice pack on top. Okay, so this has to stay frozen going to the lab, which is why we're doing all these intricate little things, because they'll send it back to you or send you another kit if it arrives frozen. One little tip here, I would recommend that you tuck the corners in, make sure you tuck those corners in. So the next morning they can get their lid to go on top. And if the corners aren't tucked, doesn't do very well. Next thing you do is put a rubber band like this around the box so it stays together. And then they only put this together or pull it out of the freezer once they're ready. Comes with a FedEx bag. You open that up. Sorry, address. So they do this actually. And put that in the bag and take it to the FedEx. Don't put it in one of those drop boxes because this is actually overnighted to DHA Labs. And as I said, they will just send it back and say we can't do this if it's not frozen. So now we're going to do a little diversion on the Walsh testing and addictions. Could this be a useful tool for working with people with addictions? And I'm firmly in the camp of yes. Just a few thoughts on addictions, however. This is a complex condition. And as those of you who are working in the field, because it's related to the brain's reward system, which we all have. And oh, I don't feel so good, so I'm going to give myself some chocolate, or I need ice cream because I just finished my exams. That reward center we all have, but it's different for people with addictions. And as you know, these can be substance addictions like opioids, marijuana, other chemicals, or behavioral like gambling, hoarding, sexual addiction. So there's different types of it. Genetics play a big part in it. About 40 to 60% of addictions they think are now inherited, not related to one gene, but multiple genes, which is actually what's happening with a lot of mental health issues as well. So addictions have a strong link to depression, post-traumatic stress disorder, and bipolar. And half the people who experience mental health disorders also have substance abuse disorders. So the question becomes, what is the chicken and what is the egg? And are people using substances to self-medicate their mental health disorders? And I would say, yes, that's happening more than we really think is really going on. So I think there's a very strong issue here. As we said, it's complex, but it could be the egg, the um, the substances that are causing more mental health disorders, and then the mental health disorder is there and is causing addiction. It's all wrapped up in a very confusing package for a lot of people. So there's some other issues here about addiction. The access at home is a really big component of this, with family members maybe sharing marijuana with their children, and community access that there's certain communities where substance abuse is just part of what's going on. It's quite easy to pick it up in even places where you think it's not available. I had one client tell me, give me 5 to 10 minutes and I can have you anything that you want. Heroin, opioids, marijuana. And this is a small college town and you don't suspect that actually. But she knew how to get to those networks. Also, the ACEs, or what's known as adverse childhood events, leads to a wide range of disorders, and that includes addiction as well. And those adverse childhood events are trauma. There are lots of them, but abuse, sexual abuse, physical, mental, and emotional, and being exposed to a lot of violence in their community. So it's complex. So confessions and comments about this. And I was trained by Dr. Walsh about 12 years ago. And at that particular point, he said, we do not work with people who have addictions. And the reason is because one of the most difficult issues is compliance. And that's why the Walsh protocol often fails. And even in working with children, he said we would find the nutrients hidden behind the couch, or the kid would put them in the plant when the parent gave them to him. They were hiding them, flushing them down the toilet. And so he also found people with addictions non-compliant as well. There's a lot of treatments that are out there where there's not really many drugs or substances that people can take. But I spoke to one of my patients recently. He was an alcoholic. I guess he says, I'm always an alcoholic, but he's been clean and sober for 20 years. And this was his quote. He said, an alcoholic is someone who knows what they should be doing, but they just don't do it. And I said, well, that's pretty much the definition of noncompliance. And as you know, that when children or even young adults are using alcohol or substances, it changes their brain. And I I liken it to like when you scratch a record. In the old days, we had records that we used and we scratched it. It was okay if it was a light scratch, but when it was a deep scratch, it changed the record. It jumped, it hopped. It wasn't the same thing. So when people are using these substances because they're affecting their neural pathways over long-term use, they don't have the same rational thought patterns that you and I do. Like we're rational, sort of, but we're not completely rational. So that's what's happening in long-term use. And it changes those brain pathways. So talking about it or knowing what you should do is like, that's why you can't actually do it. So one of the reasons that um, I am talking about this particular thing is that in February, I attended one of Dr. Walsh's seminars, and he presented some new information about working with addictions, and that's why I want to share that with you. Um, in addition to the Walsh protocol. So I do have experience in treating people with addictions, but it's usually with homeopathy, other nutrient therapies, um, and some other types of things that I do, herbal medicine. But this is the first time I'm really launching into treatment with some of these substances that Dr. Walsh talked about. And I'm hoping that some people in this group might be interested in putting together a little study or protocol and see if there is an effect. There's certainly a lot of research out there. So, but that's why I'm really excited to talk about this addiction thing. So, first of all, you want to start with the nutrients that we talked about in the Walsh testing, the zinc, the copper, ceruloplasmin, which is a protein that carries the copper around, and whole blood histamine. In addition, I always do vitamin D, thyroid, ferritin, and iron. And as I said before, if these people have not seen a doctor in a while, you need to check their CBC, complete metabolic panel, as well. So, and I do the urine testing for the Pyrroles because these people probably have a high oxidative stress, and it could be genetic, um, or it could be from their lifestyle where they're not eating well, they're taking lots of substances, and they have a poor lifestyle. There are some people that have genetic Pyrroles, and I don't think I talked about the levels, but if it's less than 10, it's normal. If it's in the range of 10 to 18 or so, that's considered mild. 10 to 20 is mild. And then it becomes moderate when the pyrroles are like 20 to 35, and then pretty severe after 35. That's the range. And sometimes, however, you're going to see it, the level of pyrroles in the urine at 78. And I had two young men in my practice who had that level. And we reduced it down to normal by doing the nutrient protocols, and their behavior changed dramatically. One was headed towards detention, I believe, and the other was headed towards alcoholism. But I, at that point, was a young doctor and took them off the nutrient protocol only to find out that they relapsed. So we, of course, then went back on the nutrients. And those are people when the urine pyrroles are that high that I do believe are genetic. So you can treat them, but it's going to come back if they don't continue getting treated. So the reason that I think this is really important is to do a baseline is the of the Walsh testing is for the whole blood histamine. And so the analysis of these chemistries will direct your nutrient treatment protocol. And that's why it's really important. So whole blood histamine is a marker for methylation, and this is inherited. And this is laid down in the first 2 to 3 months of after fertilization, after a woman becomes pregnant. So in those first few months, when the fetus is developing, then the markers for methylation are set in. Let's just say something about methylation. It is a huge thing in your body as well. A methyl is actually a CH3 group, 1 carbon, 3 hydrogens. Okay. But methylation is set in pregnancy, and it's also done on a routine basis like 12 million times. It's the exchange rate. So like a dollar or a euro, you do something with that. So you use your money to buy or sell or do things of that nature. Methyl groups are used in the enzymatic reactions of your body to make things happen as well. So think of it as like euro or dollar. So a normal range for methylation is 40 to 70. And if you're under methylated, you are greater than 70. And over methylation is less than 40. I know that seems really weird, but think of it just like thyroid. If your TSH is high, then you're hypothyroid. If it's low, you're hyperthyroidism. That's a good way to keep this in your brain. But those are the ranges. And Dr. Walt says that 70% of the people in our population are normally methylated. About 22% are undermethylated, and about 8% are overmethylated. That's what I call my special group of clients because they're a little bit rare. And I just talked to one this morning, actually, who's wanting to get back on his nutrient protocol. So why does this methylation make a difference? Because it's going to determine which nutrients that you give to these people and what extra supplements you're going to give them for addiction. So that's why you want to do preliminarily that set of testing. Okay. And so in his lecture, Dr. Walsh talked about NMDA receptors and glutamate. And so when I went to medical school, they never talked about NMDA receptors. I think they had them, understood them in science, but long ago, it was not talked about in medical school. We talked about dopamine, GABA, and serotonin. So now the NMD receptors are becoming more recognized for addictions, OCD, and like I said, addictions to drugs and alcohol. And so glutamate is the main neurotransmitter that affects NMDA receptors. And so it's really important that we take a look at this. And so the people that have very high activity at their NMD receptor are undermethylators. So they have low serotonin, but they also have high NMD activity or excessive glutamate. And so we have been treating OCD in these undermethylated patients. And now Dr. Walsh is very interested in moving that forward to alcohol and drug use as well. So let's look at this. Undermethylation, these are the people that have the low serotonin, as I said, and elevated NMD activity. And their treatment protocol consists of SAMe and methionine. Do not give these people folates, including psychiatrists who are giving people depletion, or which is a drug level of folate. Don't want to give them that. But the nutrient that has really been studied, and I would recommend that you go to PubMed and look at NAC and all the studies that have been done with obsessions and addictions. There's more and more coming out. So inositol is another substance that also helps people with sleep and calming down the nervous system. But again, notice this is on the undermethylated side. But the good news is that most of the people you're going to come across, 22% of them are going to be undermethylated. But in addiction, you might see more overmethylation. So that testing is important. So I wrote down with NAC, the recommendation is 3 to 4 grams a day. But I say wean up, meaning go slowly with that, because there was some information that said at a low dose, it's an anti-epilepsy drug. So it helps at a low level for epilepsy. And then at a higher level, it actually can cause it. So wean up on that dosage. I start with people having like 1,200 in the morning and then maybe 1,200 in a week or so at night and going up to 3 or 4 grams. That's when you notice the greatest difference when you're at that level. In inositol, same thing. You can start at 1 gram, go to 2, 3, and 4. So that's undermethylation. Now, overmethylation, do not give these people SAMe or methionine. And they do horribly with SSRIs like Prozac, Zoloft, Lexapro. You may have some people that you know who within a day or two of taking SSRIs feel terrible. They are probably your undermethylated patients. So they will be getting folates, niacinamide, and to help reduce their dopamine and levels and elevated norepinephrine. These are people that you want to give them D-serine to help bring up their NMD level. And that's the dose that Dr. Walsh recommends, 250 to 500, and avoiding inositol with these people. So here's a little bit about NAC, which I find to be a fascinating substance because it targets the same pathways common to disorders like OCD and bipolar. And I think he came across this research because he's just coming out with a new book on bipolar. And so then I think that's helped him turn his idea around. Well, maybe we should try this with addiction. And the research is showing use with gambling, marijuana, cocaine. And what he wrote, what I read in my notes from his lecture, is that it doesn't seem to reduce the high, but what the NAC does is to improve their executive functioning, meaning it helps them make a little bit better decisions and to maybe make better choices in their life. We'll see. It works differently for everybody, I'm sure, but that's the mechanism that they think this is working. And so NAC has a couple of reasons that they think it's helpful, is that it helps maintain oxidative stress in the cell. So it acts as an antioxidant. And you notice Dr. Walsh is very big on oxidative stress using vitamin C and vitamin E and other things because a lot of our brain dysfunction is due to oxidative stress. And it has anti-inflammatory properties, which is a little different, working with IL-6 and IL-7 and mTOR. Those are more anti-inflammatory properties that you see not only in mental health, but also in cancer. And it helps modulate the neurotransmitter pathways and works with glutamate and dopamine. But that's just a brief synopsis of, well, how does NAC work? But go to the literature and you'll find out much more about it than I can talk about in this lecture on this. Very interesting work they're doing. So again, I think I've stated this before, but treat the underlying mental disorder, which is really going to help people with their anxiety, depression, which may and then be causing their substance abuse. And then use the strong antioxidant treatment to reduce the inflammation. And the reason that I think the nutrient protocol, the testing is important because it gives you those guidelines for which substance that this person may need if they have OCD or addictions. Do they get NAC and inositol, or do they get D-serine? And those are important choices. So that's why the Walsh protocol is going to be invaluable for your addiction treatments. I always have to throw in my spiel for dietary considerations. Just like children who have ADHD and only want to eat macaroni and cheese and chicken nuggets, it's hard to introduce dietary considerations for people. I think it's a good place to always introduce it, though, because it affects your mental health greatly. And it's basically 3 really important things so they don't get confused. Just eat real food, and that means fruits and vegetables. Tell them to eat steak. Tell them to eat pork chops, chicken, fish, whatever they want. And fruits and vegetables, and blend it up in a smoothie, cooked, eat a salad, whatever. But if you can get people to do one thing, stop eating processed foods and sugar, because we are becoming so nutrient depleted. We're using these foods as energy and not getting nutrients. There is in this country a huge increase, 3 times the rates of scurvy in this country in children, and particularly in the low income families and males who are obese. But scurvy, it should be not an issue. That is like a total deficiency thing. But now we are seeing people come up with scurvy, and has horrible effects for our bones and our mental health. So we know that the food situation out there is pretty terrible, considering that 75% of the people are eating their meals ultra processed and they're eating them out. Eating healthy fats, which saturated fats are my thing. I'm a fatitarian. That you should eat butter, ghee, olive oil, coconut oil, and those things. The main reason is that it provides nutrients. The fat-soluble vitamins A, D, E, and K are in those fats. But it also helps stabilize people's blood sugar. A lot of alcoholics have hypoglycemia. And so if you can help treat that, then it helps reduce their craving for alcohol. And so some of my clients who are ex-alcoholics then become sugar addicts. So we see that hypoglycemia is very, very significant in some of these people with addictions to sugar or to alcohol. So that's really important thing to put into your little toolbox to help your clients. So thanks for your attention. I hope this was helpful, and I'll answer any of your questions that you need answered in the following. Thanks for coming.
With Dr. Madhava. We are partnering with the Alliance for Addiction Solutions today, guys. The Alliance for Addiction Solutions, or AAS, is a nonprofit organization dedicated to promoting integrative and nutritional approaches to the prevention, treatment, and recovery of addiction. I have a little bit more bio written, but I know Shelly Joe here is a chairwoman on the AAS board, and she is going to talk just really briefly about what they're doing and how you can support their mission. Shelly Joe.
Hi, Caitlin. Thank you so much for letting me speak on here. So here we are. We are the Alliance for Addiction Solutions. Just like you said, it is nonprofit, and it is transferring addiction, improving brain health through nutrition and integrative therapies. That's what we're bringing to the world, is giving them this information and the trainings and options that most people don't know about. Even now, even though this information has been out for a long time, people are not aware of it. So it's new information that people do not understand. So we offer trainings. We offer these once a month webinars. So you can see here our next one in April is about high potency of THC cannabis, what you need to know, the problems and solutions. And then I'm actually going to be speaking in May on You Think You Control Your Life. And we'll be talking about amino acids. And I'm also a certified hypnotherapist. What we want to do is let you know that this is available. It's here that you can get some learning. There's a lot of resources on here. There's also a members area for practitioners who want to promote their business on the Alliance. The $120 a year. You can put up your own information. You may become possibly a speaker for the Alliance. We are wanting to share this information anywhere that we can. We do take donations, so it takes money to get this information out, obviously. That we are also going to be at an incredible workshop or conference called Feed the Recovering Brain 2025. The speakers list is phenomenal. It is the movers and shakers that are in this world, in this addiction recovery, wanting to make a difference, wanting to help out. That we encourage you to look into it. Join us there. We'll be there as a sponsor. The big thing is we want the world to understand that there are treatments I shouldn't call them treatments, right? Because can't use that word, but there are different alternatives to finding out what is wrong. Because the one thing that made me angry is when I learned all this, I thought, why didn't I know this when my daughter was 6? Maybe she would have turned to drugs and alcohol at age 15. And so, Dr. DeLaney, thank you for this presentation. I use the DHA labs for my clients. And it's wonderful. It's a wonderful a tool. So thank you guys. Please join us. Please sign up to be on our mailing list, get the newsletter, and help us spread the word that there are solutions for recovery that most people don't know about. So
First, I'm going to introduce Dr. Madhava and Dr. DeLaney, and then we will go from there and do some live Q&A for Dr. DeLaney, and hopefully Dr. Madhava can jump in as she can. And you guys know Dr. Susan DeLaney, so she's a naturopathic doctor. She focused on homeopathy when she was in school. After she earned her nursing degree, she went to naturopathic school. Following her training, she actually did her residency with a physician in India, which is really cool. And she has done advanced training under Dr. William Walsh, a pioneer in the field of nutrient-based psychiatry and biochemical individuality. She specializes in identifying and addressing underlying biochemical imbalances, such as methylation disorders, pyrrole disorder, copper zinc imbalances, oxidative stress. I could go on. You guys know who Dr. Susan DeLaney is. She's wonderful. She is my very favorite presenter that I get to work with through DHA. And Dr. Madhava is here too. She is a board certified psychiatrist with over 2 decades of experience in integrative and addiction medicine. She's known for her compassionate whole person approach, and she combines conventional psychiatric care with nutritional and functional medicine principles. So she is really supporting her patients from a holistic point of view, which is so important to us. And she's a board member of the Alliance for Addiction Solutions. So you guys, here we go. We're finally to the live Q&A portion. Again, if you got to leave early right at the hour, please fill out our survey so that we can see how we're doing. I'm going to post the link in the chat here really quickly. But first, question for Dr. DeLaney. How long does it take to reduce pyrrole levels in severe cases, in mild cases?
So we retest in 3 months. And you should start to see the nutrients help people in 2 to 3 weeks. And but I always like to follow up in 3 months and then again in 6 months if we need to. Someone, hey, Caitlin, someone asked a question that I want to follow up on early on, that
Sure.
the dose of biotin is 1,000 micrograms twice a day, not milligrams. And then someone wanted to know what was the measurement for 10 when you say to someone's pyrrole is 12, that's in micrograms per deciliter. Okay, I just want to get those out of the way.
Yeah, I just wanted to say that I'm not a psychiatrist. I'm an internal medicine physician who's board certified in both internal medicine and addictions. And I'm a functional medicine practitioner. But I've also taken, not but, and I've also taken Dr. Walsh's courses. I'm trained in his program. So
Perfect. Yeah, Dr. Valsa, sorry I messed that up. I must have read something wrong on a website. Okay, thanks for answering that question. Dr. Madhava, please just jump in here when we get to the addiction questions or any question you feel like you can weigh in on. You know, I really want this to be a roundtable discussion between you guys. And
yeah,
let's see.
DeLaney she did an awesome job. So she's great, and she's part of the group, the Walsh group, and she answers a lot of questions. So she's just really awesome. So I think she knows
Yeah.
much more than I.
Dr. DeLaney, do pyrroles change over time, and what lifestyle modifications influence them?
So I'm going to talk down here. So maybe my speaker, is that a little bit better, Caitlin? Can you hear me
Yeah,
better?
I can hear you fine. You guys, can you hear Dr. DeLaney okay?
I can't hear her. But anyway, we'll try this. So some pyrroles are genetic. Okay, that is a genetic problem. And my feeling is they'll always have to be on nutrients to prevent that. I've had that personal experience, and it wasn't good relapsing. Yes, pyrroles can go down, and they can stay down depending on the issue of why they're high. Someone wrote in the chat that after their son died, their pyrroles were 100. And that is because that person is under a lot of stress. And that can happen in your life as well, just from losing a job, being homeless, lots of things can make your pyrroles go up. Also, Dr. Walsh told us that if you ever see a pyrrole over 50, you should start being concerned there might be a chronic illness with that, potentially cancer. Now, don't go around telling your patients that, okay? And so I decided to test this out. I have a patient with a chronic lymphocytic leukemia, and so he's had cancer for about 15 years. We've treated it with other things. I checked his pyrroles, and lo and behold, they were 66. And so as part of his cancer treatment, I put him on the pyrrole test, and it really helped his cancer as well as it came down to 6 or 7 over time. So you can have high pyrroles for a variety of reasons.
Thanks, Dr. DeLaney. Yeah, that was great. Yeah, please, if you guys could just lean. They say my sound is fine, but if you could please just lean forward and get close to the mic. For some reason, both of your sound is a little bit quiet. We're not sure why. Brian is asking if we can go over the doses and the ranges again. Brian, what I'll do is in a couple questions, I'm going to share my screen and I'll pull up the reference ranges so that Dr. DeLaney doesn't have to list them up, and then you guys can see them. Take a screenshot because the Walsh-Pfeiffer ranges are different than the reference ranges. And that's why you want to order from DHA, because the report you're going to get is going to include those Walsh-Pfeiffer ranges in addition to the LabCorp ranges. And you'll get the recording tomorrow, of course. Okay, pale skin are light-skinned people more prone to pyroluria than darker-skinned people, Dr. DeLaney?
I don't really know how to answer that question. I think you could have it if you're dark skinned, if you're purple or polka dotted. But what he does say that is a characteristics of some people who have pyroluria. And so that's all I know. And that they have fat distribution issues and all these other things on that list. But everyone doesn't have that. Everyone doesn't have all of that whole list of symptoms.
I think it's probably due to some of the nutritional deficiencies that these folks have. It's
Uh-huh.
because, the urine is pulling out because of the Pyrroles, high Pyrroles pulling out the zinc, the B6, the omega 6s particularly. So those having low levels of these key nutrients can lead to other effects in the body. I think that's why we see some of those symptoms is because of the low levels of these key nutrients.
Thanks, Dr. Madhava. Dr. DeLaney, do you have anything to say for people who have patients that the high cost of testing is really tough to navigate when, if it's pyrrole disorder, it could be everything, it could be the root of everything. So how are you navigating patient cases that insurance won't cover this test and they're limited in the financial resource department? Are you running other tests instead, or do you just run the cryptopyrrole?
So in a lot of people, I don't, adults sometimes, it depends on the symptoms of the patient. I always start with the pyrrole test in children because they don't like to get stuck with little needles. So I do the pyrrole test, and I had a case where his behavior was so bad. The mother was terrified of this boy. He was hitting her and waking up at night with nightmares. It was just horrible. And his test pyrroles were high. And then I also said, well, he's 12 years old. I would really like to know what his zinc level is before I do it. Pick out the dosage. Turned out to be 56, which the normal range is 90 to 135. So I almost started crying because this child was adopted. He had an alcoholic mother, and it's like he didn't have a chance in life if this mother didn't care for him in the way she did, because he was headed towards juvenile delinquency for sure. And so we brought his zinc level up in B6 and P5P, and he's really making great progress. And so someone wrote that, why do the pyrroles anyway? Can't you just test the B6 and the zinc? The zinc that you use is plasma zinc, serum copper. It is not RBC zinc. And he says that Dr. Walsh says that you cannot rely on B6 levels in the blood, that he doesn't ever test those, that he feels like it's not a reliable test for what's going on in the brain. And someone just wrote that, oh, yes, medications can deplete your B6 levels too. And that would be anybody who's on birth control pills and hormone replacement therapy for sure. And then other ones, diuretics, they also deplete zinc and magnesium and potassium as well. So,
Yeah. And sometimes I don't do the testing either because I'm from New York. So it's a little hard for some of my patients to actually, get the test out. So oftentimes I will use the questionnaire. And I think Dr. Walsh is also sort of saying in New York, what can you do, right? So as, Caitlin is giving us some opportunities to find a workaround, but it's still a little bit of a workaround for many people.
Sure, it is a large workaround for a lot of people. We recommend this for providers in Canada. Hey, ship 12 tests out to Canada, so you only have to pay shipping one time and hand them out to your patients. New York, it's even harder than that. So I understand that I'm giving a possible solution, but it doesn't mean it's an easy solution. Dr. DeLaney, that was a really great segue into our next question. So people are asking, why are you using the forms you're using of copper and zinc? Because many physicians in the field don't really disagree on, the plasma zinc and serum copper. And people are wondering, why do you use those two methods? And I'm going to share my screen right now so you guys can see the reference ranges while she talks.
so the question is, why do I use those particular?
Yep. Why are you using plasma zinc and serum copper over serum copper, serum zinc?
That's because it's Dr. Walsh's recommendation. And he is a biochemist. And actually, he goes to the zinc conference every year where that's all they talk about is zinc. And so if he says that zinc is better was a more reliable test. That's why he does it with plasma zinc. And part of that reason is because, and it uses a specific tube as well, that there's some leaching from the tubes, glass or the plastic, whatever they are. And so the zinc could be inaccurate. That has something to do with it if you just do a serum zinc. So you can do a serum copper. He says it's very reliable.
Mhm.
And
Yeah, that's a
go ahead.
No, I was going to say that's a great answer. You know, when you order from DHA Lab, we specifically recommend that plasma zinc and serum copper because when you order serum zinc, you can get an elevation in zinc. It's super common because of the contamination of the tubing that they use. So a lot of providers are seeing, you know, they test zinc twice in 1 week and the metrics that are coming back are far apart. That's potentially because of the contamination in the tubing. So when you order plasma zinc, they're using a different tubing and it's all about the tubing. So when you order from us, we're making sure you're getting the most reliable measurement of zinc. And that is, like Dr. DeLaney said, right out of the Walsh protocol. Dr. DeLaney, do you use any hair testing for any of these markers?
Not for these, but I do use hair testing for Dr. Walsh says the 5 big important ones are mercury, lead, cadmium, arsenic, and Dr. Madhava, help me out here. Is it antimony or
Yes.
something like that?
Yeah, actually, I use HTMA, so I use it consistently for mineral analysis and for toxic metals. And there they have many aluminum, arsenic,
Yes.
cadmium, uranium, mercury. They have like 6 or 7 different toxic metals. And for the nutrients, they have sodium, potassium, phosphorus, magnesium, copper, zinc, iron. So those are the nutrient minerals that they check, and then the toxic metals, and then they give you ratios. This is trace elements. So I do like the hair HTMAs.
Also, lithium is an important one to measure from Dr. Greenblatt, and he uses a lot of that. He has a new book that's just come out about lithium. I don't believe, however, that you can use the hair and copper levels as a substitution for the blood because we do not know if a high calcium, particularly in the hair, is a low or a high calcium in the blood. And I really feel like give your patients the most accurate information, it should come from the blood, except for toxic minerals, because they are cleared by your liver and other processes pretty quickly. So they're found in the hair.
So you covered blood testing a little bit for the other minerals, Dr. DeLaney. Can you again let us know, is there any benefit to blood testing B6 or magnesium in the blood in regards to pyroluria?
Dr. Walt says he does not test for B6 because he doesn't believe that is a reliable test. He also hasn't recommended to us in the past testing magnesium. I don't know which is actually the most reliable test. I think it's RBC magnesium. Dr. Moldova, you might know that. But most people are magnesium deficient, and it's kind of like measuring calcium. It doesn't matter if you have osteoporosis or kidney stones or calcified arteries. That calcium is going to stay in that range, 8.5 to 10.5, no matter what calcium diseases you have, unless you have parathyroidism. And that's a whole different thing. But your body needs calcium every split second of the day for muscles, for firing your nerves. So it's going to guard your calcium level. And I think it has a little bit that same way with magnesium as well.
Thanks, Dr. DeLaney. Can you tell us, does your methylation status change over time? So if you have normal methylation now, how could that change in the future? And are you only using whole blood histamine to track live methylation status?
Dr. Waltz says he has seen a few people change methylation status. But basically, He says you just need to test it once or twice to confirm your methylation status, that this is a marker that you obtained during your embryonic stages. So I think he's seen it in some of his clients, but I have never seen anyone change. And what was the other question? Uh,
Are you using any other method to
Oh.
measure methylation besides whole blood histamine?
Dr. Walsh is starting to use the methylation panel, I think by doctors' data, where you look at SAMe, SAH, methionine, and that is very useful. But I would just have to say it's expensive and it's a little harder to do the testing, and the whole blood histamine is the most reliable. However, a whole blood histamine level is affected by two things: SSRIs, SRNIs. So if they are on medication, I do not even test their whole blood histamine because it's unreliable. If they're also taking antihistamines, it's unreliable. So they say, well, you have to stay off of your antihistamines for a month. I don't know many people who are thinking that's a good idea, especially during springtime, because they'll fall asleep at the wheel and they had their allergies are so bad for them. So I just make the assumption if they are tolerating their SSRI, their medication, that they are probably undermethylated, and unless they're willing to come off those at some point with their doctor's advice. Um, but I just assume that they're undermethylated. But I will
Also,
do that test if people want it.
yeah, only LabCorp has whole blood histamine. Quest doesn't. So if a patient doesn't have the right kind of insurance, if their insurance doesn't, if they don't have an insurance that covers LabCorp testing, you're not going to be able to do that. So that's definitely a limitation for many people.
Mhm.
But we're going to continue going until Dr. Laney waves the white flag at me. So you guys were talking about you use a specific hair mineral test. Are you using doctor's data, HTMA? Which one do you use, Dr. Madhava?
So my name is Madhava.
Madhava, sorry.
It's okay. It's Trace Elements. I use Trace Elements. They're based in Texas, and they've been
Okay,
around time. And I trust the testing, and I do it for myself. I find that it's very useful.
great.
They
And
also have,
we,
yeah. Sorry, I think you meant, Dr. Susan, you mentioned lithium. They also test lithium in the hair.
yeah, lithium's a good one. We have a spokesperson from the Walsh Research Institute in here, Dolores, if you're still here. She said in the chat, yeah, lithium for hair test. Dr. DeLaney?
I just want to say, I think that people that work with addictions are just like remarkable human beings. And I was a burn nurse for a long time, and I think that was a group of people who are remarkable human beings as well. But I have a special affinity because I have an opiate addict and an alcoholic in my family. And I just want to say, if anybody wants to get together in a group from this addiction treatment, I will work with you on in a group level. We can talk about your cases, get the testing done, and see if we can move some of these cases forward with the Walsh protocol and the addition to the nutrient protocol that Dr. Walsh is now recommending, the inositol and the NAC. I'm open to doing that, and reach out to Caitlin if you want to do that.
No, it sounds like a great idea, actually. Yeah.
Yeah. Especially, I think, since Dr. Walsh, he doesn't have any data on these people, and the research is coming out. And I think if people are interested, we should try it and see if it's helpful for them in their lives. Because there's not a lot of other things that are helpful in terms of, you know, medications and whatnot.
Yeah. What we use for addictions, the Alliance, and is we use a lot of amino acids as precursors to neurotransmitters. And
Mm-hmm.
then, of course, we need the nutrients. And if someone is, pyroluria, of course, you need to address, large doses of those specific nutrients. But
Mm-hmm.
our foundation is using amino acids as precursors to neurotransmitters.
Mhm. How do you reduce the cravings? This is our biggest upvoted question on the addiction side.
The way I help people with cravings for sugar, which is kind of alcohol, is to make sure they eat fat. And number one reason is because they're nutrient deprived. We've been in a culture that said, don't eat fat, don't eat fat, don't eat fat. And so they're nutrient deprived. And then if they feel satiated with fat, then they don't have sugar cravings. They don't have this dip in their blood sugar. And so I do this with just people who can't control their eating habits. And because they're on this low fat diet and have been for years. So I recommend a modified ketogenic diet, actually. And people go, really? One thing you should know is that the Mediterranean diet, in that they have 4 tablespoons of olive oil in that diet every single day. I don't know any American that eats 4 tablespoons of fat. Then they have fish and lamb and nuts and butters and cheese. So that's a high fat diet. It's not low fat. And people are starving for nutrients and they're starving for a sense of satiation. And you can fix that with fat. Just
Yeah.
try it yourself. I can prove it. You'll prove it to yourself.
I think we would say the same thing, except we'd probably say have a lot of proteins every 3 hours, consistent protein every 3 hours. That's foundational. High protein diet, then high fat. And then we have a product called DLPA or endorphin. It's an endorphin support product. D-L-phenylalanine or just D-phenylalanine. They'll increase the endorphins. That will help some of the cravings. But then we really map out the different neurotransmitters by symptoms. And then we figure out which ones they may be missing. It might just be like, it may not be just the endorphins, but it might be others. So glutamine also is another one that helps with sugar cravings. So glutamine and DLPA or DPA is what we recommend for cravings, but we don't use it in isolation with, we also look at the other neurotransmitters. It's like a cacophony, right? Like everyone, all the different neurotransmitters sort of need to be in some sort of balance.
Dr. DeLaney, have you seen any relation between hyperbilirubin and pyroluria? So jaundice and pyroluria?
I haven't, but I haven't looked. I don't think I've had many patients or any patients of hyperbilirubinemia, more hyper, you know what I'm trying to say. I haven't seen high bilirubin in too many patients unless they've had the, some type of hepatitis. I see it then.
Thanks. We talked about the whole blood histamine and how you just measure it twice. Someone is saying their daughter tested recently and her number changed from 39 to 113. How could that be possible?
First of all, think lab error. That's what I would do.
Wow.
And the second thing is, so I would actually retest that a third time. And and also it could be that she was taking medications for allergies or any, the only 2 that I know and Dr. Waltz talks about is SSRIs, medications for depression and antihistamines. And a lot of people don't consider antihistamines over the counter that they're taking a drug, but they are. But I would retest that. I think it's some sort of confusing error. I would just say lab testing in general. I have gotten hysterical before about this certain test. This woman's kidneys were like failing. Her GFR or glomerular filtration rate was 35. She's like a 42-year-old mom, and she was hysterical too. But we retested it and it was pretty normal. So
what I would add is not to use any testing in isolation, just a general statement. It has to be consistent with the symptoms, but it's very useful. Testing is very useful, but sometimes you do get lab errors or drawing errors or some sort of errors. So just, people get very hysterical when their labs are really out of their range. So
including doctors get hysterical.
Yeah. That's a great distinction. Hey, Dr. DeLaney, when you say to avoid folates, can you break down that? So distinctly folic acid, folate, methylfolate, folinic acid?
All of them in undermethylators. Okay, it doesn't matter. And the problem is that Dr. Waltz talks about this is that they put folate in everything. It's in bread, it's in your muffins, it's in grains, it's in everything. So our culture is getting tons of folates. And he actually is proposing that that's the reason we have fewer overmethylators right now. So that it's shifting the culture towards being more undermethylated. So we've already gotten tons of them through all the processed foods that we eat. Any kind of grain typically has it if it's milled. So, but folates have a very different effect genetically on your neurotransmitter proteins. I don't want to go into that too much, but it's the undermethylators who should not be taking any folate extras. They get enough in their diet. So just avoid them all.
Thanks, Dr. DeLaney. Can you use glutathione instead of NAC?
Well, Dr. Walsh again says you don't actually absorb that glutathione really well. That some people get hyper agitated from the copper that they're dumping when we're treating them. Okay. So it doesn't happen always, but I see it in some really sensitive people. I think that's what they mean by copper dumping. Okay.
Yeah, I think when you do HTMA, I think those folks will tell you that there are a lot of people who have high copper levels. That's also something that's prevalent in the population of the last decades. And so high copper is more common than low copper when you're doing HTMA. This is not referring to blood. And so there's the HTMA world talks about copper dumping a lot because they see it a lot in their hair testing.
Have you seen any association with high copper and seizures?
I have not. And I've seen some pretty high coppers, like 205. But I will say, I had a patient who schizophrenic, and I started treating, and he was on blood pressure medication at age 23. I thought that was odd. And so I called Dr. Walsh about it. And he said, so when we did the nutrient protocol, the doctor said, well, we're going to take him off his blood pressure medications because he doesn't need it. So his blood pressure dropped from the nutrient protocols. Didn't surprise me really, but in the call, Dr. Walsh said, I have seen people with migraine headaches, with seizures, and also with blood pressure medications that those things get better as a result of treating people for their imbalance that they have. Now, that doesn't always happen, but I have seen that happen.
Any final thoughts?
I think it's awesome that we're looking at different ways of treating so-called mental health issues. It's really about brain health. I think mental health is a pejorative words, mental health. I think we're talking about brain health, and I think we can improve the brain, as Dr. DeLaney was saying, increasing fats in the diet, increasing protein, and then really looking at the root causes, like we look at the root causes in the body, like whether it's gut health or autoimmune. Same thing, we can look at the brain that way and sort of say, okay, what's the root cause of this symptom? Take a symptom and sort of say, okay, how can we help that symptom? And we don't do that. We just, in general, it's all about diagnosis, and then we don't have enough research really. Like even in the functional medicine field, there's not that much around mental health, but I mean, in terms of brain health, there is some, but a lot of that is neuro, like, it's more around dementia, not so much around addictions and really around the need for medications, just really looking at that brain health piece.
And I'm just going to second that about brain health because I think we're starting to do that now. And Dr. Walsh says, they're not really bad children. There's bad biochemistry in their brain. And so my heart goes out to those little ones who maybe genetically have that, or for stress have that, or poor nutrition, whatever. We need to treat them that this is not just bad behavior, it's bad biochemistry. And that's true for addictions too.
Yeah, I think of addictions as people using substances to make their brains feel better. That's basically, that's all it is. Like I've
Yes.
worked with addictions for tons of time, for a long, long time. I've never met a person who wants to be addicted. Most people just want their brains to feel better. There's
Yeah.
like, we call them addicted. They call themselves addicted because that's how they're labeled. But people are just trying to make their brains feel better.
And you know what? We do it ourselves. We eat chocolate and have coffee because it makes us feel better for people. So you can relate to that, but we don't take it so far as to be addicted. Though some people are addicted to chocolate, I will say.
All right. Thanks so much, you two. This was a really, really, really great lecture today. And we're on. Bye, Dr. DeLaney.
Okay.
Bye, you guys.
Thanks, Caitlin.
Dr. Madhava, you're so welcome.